Potassium is an intracellular cation that has two disorders, either increase or decrease in it. When there is a decrease, it causes hyperkalemia. When there is decrease, it causes hypokalemia. It's important for blood clotting, for bone health, and even it helps in wound healing. The plasma concentration of it is 3.5 to 5 milli equivalent. The factors that affect and maintain the imbalance of potassium are three factors that causes the intracellular to extracellular movement and the opposite, from extracellular to intracellular. We should monitor first the beta-adrenergic, which move potassium into the cell, insulin concentration, which promotes the cellular uptake of potassium. Thirdly, acid-base status. When we have metabolic acidosis, this causes potassium to move out of cell, whereas when we have it like metabolic alkalosis, this causes potassium to move into the cell. Be aware of what you're talking about or what you're taking and dealing with. When hypokalemia, potassium's concentration is less than 3.5. The causes of hypokalemia: first, increased urine loss, either due to diuretics or aldosterone. It could be increase in GIT loss, or could be an insulin problems, or could be increased shift of potassium into the cell. This is due to alkalosis, as we talked before, and even due to hypothermia. Hypomagnesemia, which is commonly associated with hypokalemia. When we are dealing with this, we should be aware of this condition and even reduce intake that could lead to hypokalemia. The causes of increased renal tubular absorption. Causes increased renal tubular absorption. The symptoms of hypokalemia: firstly, neuromuscular, could be like muscle weakness, cramps, paralysis. Cardiac problems like ECG change, flattened T waves, U waves, ST depression, prolonged QT, dioxin toxicity. Even we have gastrointestinal problems, could be constipation, nausea, and vomiting. Could be rhabdomyolysis due to reduced blood flow to skeletal muscles. We should be aware of all of these things. Even we should know when we're going to treat it, the signs and symptoms. Because if there is no signs and symptoms, we give oral potassium chloride 40 to 80 milligrams. If there is signs and symptoms, we give oral potassium chloride 120 milliequivalent per day, or IV like 60 to 80 with an infusion rate of 10 to 20 per hour. When plasma potassium is 2 to 2.5, we give IV potassium chloride 10 to 100 until we reach the normal thing. And when it's less than 2, we give it 20 to 40 IV until normalized, with monitoring, with continuous monitoring of the ECG, so that we deal with it and give the patient the right thing that they deserve. Thanks for listening.